Hi, thank you. Could I have my slides, please?
The slides from Ms. Joleen Chambers, they're the fourth down, yeah.
Wonderful, thank you. I'm from Dallas, Texas, and my brother, Stephen, is from Minnesota. You can see a picture of him. He has an implanted elbow that failed after 4 months, and that began my advocacy. I was trained here at FDA in 2010 to be a patient representative, although I learned at the time that patient representatives for medical devices rarely are called in because the devices go through 510K that does not require the patient representative to be present. I started a blog, Failed Implant Device Alliance, and learned that my brother's situation was not unique. Next slide, please. I want to thank Dan Walter. He was originally scheduled to speak, and he's a fellow patient advocate with Consumers Union Safe Patient Project and other organizations that we're a part of, and he also wrote a book, Collateral Damage. Next slide, please. The goals that I've been working on are patient harm prevention, and I know that's something that we're all working on. Mine is specifically on implants. I would like there to be a device warranty. We want the device manufacturer to have the skin in the game that the patient has, that if they're designing a device for implant, they should have some guarantee that it will work for a period of time. 4 months was not enough for an elbow. There's no plan B. Independent registry, that means a registry of all these devices that are going into human beings and that patients have access to so that we can look through those records with our care provider of choice and determine which one is best if it's not on an emergency basis. And a lot of the joint replacements really are elective. Passed the Medical Device Safety Act. It was supposed to be a part of the Affordable Care Act, and it didn't go through, and that would give patients a lot more protection when they are harmed by a device. And then also give the harmed implant patient stakeholder rights as well. We need to be at the table. What we have to say has a lot to do with improving these implanted devices, and if we're not listened to, if we're not there, a lot of the information is missing. Next slide, please. There's a lot of progress. I'm wearing a bright sunny dress. It's not just caution, there is a lot of progress. The Institute of Medicine in July of 2011 was commissioned by the FDA to look over the 510K process, and they came back and they said it's flawed from its legislative foundation and it should be scrapped. In particular, that is the case for implanted devices, and I know that this may be counter to some of the information that you'll be hearing later today. The FDA Patient Network website just came up recently, and that's a real positive move. There's also MedWatcher app for your cell phone, and I hope the patients, implant patients, learn that very quickly, that they can communicate almost directly with the FDA through their cell phone to report adverse events. And that would make the responsiveness that much quicker. The CMS, that's the Centers for Medicaid Services, Medicare and Medicaid Services, has a partnership for patients, and I'm participating in that as well. I don't know if you know that Medicare and Medicaid, their number one expenditure is the joint replacement of all categories. So it's really important for us taxpayers to be aware of how our money is being spent. PCORI, Patient-Centered Outcomes Research Initiative, I'm doing merit review later today, so I'll be missing the rest of this wonderful discussion, but that's a new agency that has come through the Affordable Care Act. And then class action lawsuits, it's a good thing. Failed implanted hips and surgical mesh, these people who have been harmed are perhaps getting some justice, but this is way too late. We need to prevent this harm as much as we can, because the judicial system is really not where we harmed patients want to go. Next slide, please. The protocol is an infinite loop for the patients, the harmed patients. So next slide, please.
And I just want to let you know, we have about 30 more minutes, 30 seconds, excuse me.
Okay. So what we need to do is, as long as the harmed patient is getting the medical care that he needs, that's not happening with my brother, and that's not happening with a lot of other harmed patients. Next slide, please. We're a symphony. All of us need to be working together for better medical care and to eliminate these harmed patients. when we have somebody who, or a manufacturer or provider that's doing more failed implanted devices than others, and there's preventable harm, they're like the cowbell in the symphony. We need to stop this. All of us are working very, very hard. We need to make sure that that's not ruining our symphony. Thank you so much.